Good morning, everyone. I'm Dr. Hughes, I'm from Brazil, and I've been working with the therapeutic reconstructive keratopigmentation for 10 years now. And it's such an honor to be here, so thanks for the invitation, Dr. Alio. Factors that we should consider while treating these patients is that they suffer a lot with lower self-esteem, negative self-image, social anxiety, fear of negative social evaluation, social phobia, and shame. They live constantly with shame. So this leads to extreme quality of life reduction. The keratopigmentation is not only a cosmetic procedure, but a reconstructive and humanizing intervention. So the reconstructive therapeutic keratopigmentation is this method used to treat cosmetically the corneal opacities and iris defects, primarily in blind eyes, as an alternative to cosmetic prosthetics and contact lenses with a very good result. In Brazil, in 2015, we finally could reach the regulation from the Federal Council of Medicine accepting and recognizing the reconstructive keratopigmentation as a medical surgery, so it needs a trained ophthalmology, surgical settings, and the regulated pigments and materials, but it forbids for cosmetic reasons. So for patients with vision, we are not allowed to do it. The pigments we use are from a manufacturer from Brazil, and they are all inorganic, micronized, non-toxic, but biocompatible, non-carcinogenic, inert, and hypoallergenic. And the techniques are the same as we've seen here, with the exception of the manual superficial keratopigmentation, which was adapted by Dr. Garotti, who is here, which is my partner in our techniques. So the body de Garotti is changed because we don't use anymore the needles, the syringe injection needles. Instead, we use this device, which is the tabori, and with a better result. But with a good result. And then what really changed everything was the use of the dermograph. So the dermograph is like a machine tattoo, but with very delicate and specific needles. And this delivers a very more effective implant of pigments. And this is a very nice picture I got from a patient of mine after 1 year of keratopigmentation with the dermograph. I had to do a PK, so I removed his cornea, and this is the pathology. So you can see that the pigment is really below the Baumann layer, and it doesn't need to go deep in the cornea. So this shows that it's really superficial, right? And the dermograph uses the cartridges, which are sterile. So in the OR, we perform the surgery with the patient sedated and blocked. And also we can move the cornea and the pigmentation in order to make it better appearance of the strabismus when the strabismus surgery is not possible, or in this case where the cornea was too large because of a glaucoma. So I did the pigmentation of the iris according to the other side, and then what was left of the cornea on the temporal side, I did the pigmentation in a pinkish color. And so this technique is possible to deliver a superficial realism and texture customization with different colors and different pigments. So we use like 4 or 5 pigments. We actually have to study colorimetry and color matching training, and we train this in our course. We have a immersion in reconstructive keratopigmentation in Brazil. So we teach the students how to make these colors to look so realistic. We also have the tunnel, the manual interstromal keratopigmentation technique. This is basically done when the cornea is clear, right? So the clear cornea with disarranged anterior chamber, the interstromal technique is very good. And you can also do the superficial technique to make better the finishing touch. And this is a very nice indication for a white cataract. So we can do just the tunnel of the pupil with a really clean surgery, fast surgery, and a very good result. And the contraindications are any active ocular inflammation, chronic epithelial defect, corneal dellen, eyelid abnormalities, corneal exposure. So any problems with the eye surface, the lids, and thinning of the cornea would be a problem. The postoperative management is contact lens, antibiotics and corticosteroids until epithelial healing, and high-frequency preservative-free lubricants. And now we do always, it's our protocol to use herpes prophylaxis and oral doxycycline, and I'm going to show you why in my next lecture. So in conclusion, the keratopigmentation is a really safe procedure, and it is satisfactory, long-lasting aesthetic results. It's not only cosmetic, it's reconstructive and humanizing. It promotes great social impact and high satisfaction rate. So thank you, this is part of our group from Brazil. It's a pleasure to be here.